Hi, welcome to Raaonline. So, a 33-year-old male developed a fever, neck stiffness, mental confusion for the past 3 days. So, approximately 10 days back, he went for a trip to North India and returned back, and where he had a bath in the river. And he also gives history of continuous nasal discharge prior to the episodes of fever and neck stiffness. And the patient was admitted, and the radiological investigation showed leptomeningeal enhancement and obliteration of the cisterns. And on day 3 of admission, the patient became very sick and was shifted to the intensive care unit and was declared dead on the same day. And post-mortem examination was carried out, which showed primary amoebic meningoencephalitis. And these are the various questions. So the question number 1 is, what is the probable clinical diagnosis? And question number 2, what is the probable etiological agent? And question number 3, what lab investigation would have been helpful in determining the etiological agent? Question number 4, what are the various morphological form of this particular parasite? Question number 5, what is the culture medium that will be useful for the condition here? And question number 6 is, what is the mortality rate of this condition? And question number 7, what is the drug of choice? Question number 8, how could have been this condition prevented? Question number 9, utility of PCR in this particular condition. So let us go into the discussion now. So here we have a patient who is a 33-year-old male, and he have developed fever, neck stiffness, mental confusion for the past 3 days. So it is going to tell the particular patient is going to have an infection which is going to involve the leptomeningeal system. So there is going to be the irritation of leptomeningeal system. That is why the patient is going to have a fever associated with the neck stiffness and mental confusion. So the duration is for the past 3 days. And approximately 10 days back, he gives history of a trip to North India and returned back, where he had a bath in the river. So he has an exposure to the water which is there in the river, and he also gives a history of continuous nasal discharge prior to the fever and neck stiffness. So it is going to tell us that the patient is going to have some sort of nasal mucosal irritation before the onset of fever and neck stiffness. And the patient was admitted, and the radiological investigation showed leptomeningeal enhancement and obliterations of cistern. So whenever we are going to have this kind of patient, we are going to go for a non-invasive procedure first. So we go for radio imaging study. So that radio imaging study have showed the presence of leptomeningeal enhancement and obliteration of cistern, which is actually an finding of amoebic encephalitis. And on day 3 of admission, the patient became very sick and was shifted to ICU and then declared dead on the same day. So post-mortem was carried out, and it showed primary amoebic meningoencephalitis as the reason. So various morphological form is going to be the amoeboid trophocyte. And we have something called flagellated trophocyte. And we have something called double-walled cyst. And the main difference between the amoeboid form and the flagellated form of trophocytes is though. So amoeboid trophocyte, there is something called lobopodia, so which is going to help that particular pathogen to move, so here and there. So it is going to be the amoeboid lobopodia, that is why it is called as amoeboid form. And in flagellated form, there is going to be the particular parasite, and there is going to be the flagella. So with the help of flagella, that particular organism is going to move. So the flagella is going to help that particular organism to move from one place to another. So there are 2 forms of trophocyte. One is going to be the amoeboid trophocyte, and another is going to be the flagellated trophocyte, and there is going to be the double-walled cyst. So there is going to be a double-walled cyst. So whenever the flagellated form, there is going to be any extremes of situation where the particular unfavorable circumstances can arise. So when there is going to be any unfavorable circumstances, that particular trophocyte is going to become an cyst. Okay, so the particular cyst which is going to be seen in case of Naegleria Fowleri is going to be a double-walled cyst. And this is about the various morphological form.